Hi, I'm Barb DiMarco. I'm the Director of Compliance at Trillium Health, and I've been here for 28 years. I'm getting ready to retire. When I first came here, I had the first computer. The doctors dictated all of their patient appointments and intakes, so I learned everything there was to learn about HIV. I learned about the opportunistic infections, the medications, the different studies that we were doing. So I was the only admin person. My first title was Executive Medical Secretary, and I was the only admin person there. So I supported the HR department of one person, the care managers, the doctors, the nurses, the social workers. So it was a very rewarding experience for me. I had no idea what I was getting into at the time. But I made friends and relationships, and I shared an office with 5 people in the beginning because we were in such a small, it was, as Dr. Valenti's book says, we were in the basement of a bowling alley because they wanted a place where patients could go that they didn't feel like they were in a hospital setting. They wanted it to be more like a community setting, so there were no white coats, and it was very informal, and patients came and sat in your office with you. Their family members brought us cookies and desserts, and it was an intimate time, and I think probably Dr. Valenti has said this too, it was the best of times and the worst of times. I would come and walk into the office and people would be crying. It would be like we would lose 2 or 3 patients a week, and it was very sad. So it did bring, I think there was only 30 employees when I started. Now we have, 250 something. So it was very different, but we were all very close because we supported each other.
We got through it and got through a lot of other days that were difficult with Barb in the back office helping us keep our heads above water. It was a very difficult time. It was very traumatic. And when you have people like that who will stick it out through thick and thin, it really matters to really remember people like that and remember their contributions to the effort. And she is an important part of that very, very early effort where it took a lot of work, a lot of hard work to keep that organization together. Very different than today. So I'll always thank her for that, be grateful for that, for her contributions in terms of lending a hand and being calm and thoughtful while she did it.
It's just amazing when I think back about the medical field and the field of science and what they've done in 28 years. I mean, patients were on, 50 pills a day, and now they could take 1 shot a month or 1 pill a day, and they're living normal, healthy lives where people were getting brain tumors and cancers and all kind of terrible diseases. And, people would say, oh, don't make friends with them. They're going to be dead in 10 years. And there's people still today that I've known from 1993 that are still alive and well. So it's a wonderful story. It really is.
28 years is a long time, especially if we're talking about somebody who's such a valued employee. It's so good to work with, trusting. When you ask Barb to do something, she'll do it, and she'll get you the answer you need, and it'll be honest and direct and real. She's just an absolute pleasure to be around. Just so calm and so thoughtful. And even when I'm all worked up, if I have a little dose of Barb DiMarco, I can calm down and smile because she has a very soothing, in addition to her get it done kind of attitude, she has a very soothing, kind of comforting attitude. She's sort of the mother of us all.
My favorite part about walking in every day is seeing my coworkers. I've made a lot of friends over 28 years. Seeing people and forming relationships, I think, is really important and makes your work much more rewarding. So I enjoy coming in and knowing that I contribute a little bit to the mission. I like to come in, and if somebody needs help or has a question, I'm hoping that I can help them and answer the question.
There will only be one employee 002, and we have to retire that number because she's the person with the second longest longevity, 28 years, so she will always be 002. Barb, a job well done, and that's a wrap.
I have a lot of work to do in my house, painting, new carpet, all of that. I plan on traveling more. We love to travel, so we're going to travel, and I may volunteer in the city school district. Hopefully my daughter's a teacher, and she's been telling me how the kids are struggling with reading, so I might go help her there. And have lunch with friends, because all my friends are already retired.